Well, just hours before that annual Victory Day parade in Moscow, Ukrainian officials say their air defences shot down most of the Russian cruise.
The city. The missiles were destroyed.
Line of the defence of everything great today.
Artillery shells.
Here, high street pharmacies in England will be able to start prescribing medicine for some minor illnesses such as earaches and sore throats under a new government plan. Ministers hope it will take the pressure off busy GPs and free up millions of appointments for those who need them most. Well, the move brings pharmacies into line with Scotland and Wales, but there are concerns about how they'll be able to cope with extra demand. Here's our health correspondent, Sophie Hutchinson.
You could be waiting weeks and weeks and weeks for an appointment.
It's quite disheartening, really.
It is. It's disappointing, I think is the word.
But it's everywhere.
It's our NHS that's supposed to be so good.
Portsmouth, one of the worst places to get a GP appointment. Here, the number of patients for each doctor is the second highest in England, and like many areas, services are on their knees.
It feels like a tsunami of need that is coming through to us, and it feels quite demoralising that we are not managing to meet that need.
In Portsmouth and the surrounding areas here, they say they're short of GPs by around 50%. Now, back in 2016 and 2019 in England, the government set targets to increase GP numbers. But it's not just on track to miss those two targets. GP numbers have actually fallen even further.
You okay? You been sad?
Today, the government promised to improve GP services under new plans. £645 million will be spent over 2 years to allow pharmacists to prescribe antibiotics for conditions including earache, sore throats and urinary tract infections. And they'll double the number of blood pressure checks they carry out. Patients will also be able to book physiotherapy and podiatry services without going through a doctor, and new phone systems will be offered to some GPs and training for receptionists to direct calls to a range of services, including physios and nurses.
One of my 5 priorities is cutting waiting lists, and today's announcement is getting on with that, and it's about primary care, expanding access to services that people can get from their pharmacy, but also investing in general practices, in surgeries to end the 8 a.m. scramble.
The new measures are expected to free up 15 million GP appointments over the next 2 years. That's just 2% of the total. And in terms of extra work for pharmacists, here in Birmingham, they say they're under too much pressure already.
Pharmacies have undergone severe funding cuts since 2016. Many pharmacies are running at a loss, dispensing at a loss, and they're actually running on bare-bones skeletons at the moment. We're on our knees as a sector. So the concern that we have, and we're cautiously optimistic about this service, but the concern we have is delivering the service successfully.
You know me, Dr. Jones.
The Royal College of GPs is clear what's needed are thousands more family doctors. But government plans are still unclear. Its long-awaited workforce strategy is not expected for another few months. Sophie Hutchinson, BBC News.
Pakistan's former Prime Minister